Hello, my name is Michael Skaff with Sequoia Living, and I am guest hosting Steve Moran's Tech Tuesday podcast. My guest today is none other than Jeff Gray, founder and CEO of AgeTech Connect. You may have seen his work showing up in cities around the world and around the nation at least, maybe around the world at some point, with all the local communities he's helping build. Stick around and we'll get to it right after this.
Hey guys, Steve Moran here.
Jeff, welcome. I am not Steve Moran, but I'm happy to be on here with you and looking forward to the conversation today. Let's start with who you are and what you're excited about and how you're helping advance the progress of AgeTech across the US.
Well, thank you first for inviting me to have a conversation with you today. I really appreciate it. I'm the founder and CEO of AgeTech Connect, and we are the fastest growing network of innovators and trailblazers that are trying to change the experience of aging through technology, to totally reimagine and redefine what that all means. Our mission really is to support those innovators. And Mike, an innovator to us is not just a startup founder. You're an innovator in your position at Sequoia. Researchers, educators, corporate entrepreneurs all fall into that category. We exist through our 15 innovation hubs across North America to help them succeed by giving them greater access to the 4 C's. So content, capital, customers, and community. And we do that by putting people together in rooms all across the country.
And it's been very successful. It's been great to see you guys grow and new communities pop up all over the place. Take us to, you didn't just end up here by accident, though. You've had an interesting career. You started out, I think, in real estate, and you've been through a few different industries. So tell us a little bit about how you ended up here and why this is the right time for these types of communities to prosper.
Yeah, my first startup I built it when I was living in Southern California, and it was in the real estate sector. If you've used a product on Zillow, I called the Zestimate, and got an automated home valuation report, we were one of the pioneers in that space back in 99. Moved to Atlanta as a part of that. I've been an entrepreneur pretty much my whole life. I was one of those guys who had a lawn cutting and gardening business when I was 12. So very rarely have I gotten a paycheck from somebody else. I had an experience, as many of us do, with my mother having early signs of eventual diagnosis, and then losing her to Alzheimer's. And sometime after that experience, I got really interested in aging because we had an experience of coping with all those things, getting mom into memory care, ultimately supporting her as she lived there through her last year of life, and navigating the healthcare system. And in about 5 years ago, I started growing this networking group just to help bring those of us together who cared about these subjects to support one another. And then it grew to what it is today. So that's like the short story of how I got from there to here.
And I appreciate the fact that it's not just startups, it's not just one part of the industry. I really credit that, and your vision around the sort of multitudes together will make this work better. Because unlike some other industries, technology, for example, where you can have a great idea and you can go all the way just on your own, healthcare, senior living is just not like that. So I appreciate how you bring together the right people and the right interesting ideas, and really sort of foment the progress here. And with change accelerating in this industry, and it certainly is, not just with AI, but with how senior living is being consumed, if you will, how the demographics are changing, and how we need to serve so many more people, whether they're in our communities or out in people's homes, remaining aging in place, as we like to say. How do you see these communities really helping support and bring to market some of the solutions? So I imagine you've seen a lot of different solutions, a lot of different opportunities. Talk to me about one you're excited about, and why.
Well, a couple of things. So let's talk about how the magic works a little bit.
Sure.
So each one of those innovation hubs is going to host 4 to 5 in-person events per year. They're generally free to attend or very inexpensive, kind of come one, come all type of events that encompass everything in our space, including senior living and post-acute care and those things. And I always like to tell this one story. There was an entrepreneur in Atlanta that came to one of our meetups, and he was working on something that had a profound application, he thought, in terms of helping hospitals mitigate readmission. And he's just talking to somebody who's there just like he is. And that person had a very boring title that didn't reveal that he, in fact, ran that very problem for one of the largest healthcare systems in the country. And the next thing you knew, they were off to do a study, then led to a pilot. And so there's really no substitute for putting people in rooms together where they can learn, connect, and grow and support one another. So that's kind of how it works. I get asked a lot, like, what else what are you really doing besides having these events? And I'm like, no, what we're really doing is having these events.
Well, you also encourage the conversation behind the scenes with your use of Slack is wonderful, but using a tool that helps people not just have one episodic conversation around a topic they care about, but continue the conversation, build those relationships, and actually move things forward. So it doesn't just stop with that first conversation, and that's something different I see rather than others who have tried in this area. It's great to have these conversations, but it doesn't really mean a lot unless you actually take it to market and make it work.
Yeah, I agree. When it comes to solutions that you see, I mean, I bet you see as many as I do, because you've got that title and that role where people want to bring their ideas to you and to Sequoia. I would be curious to hear your input. I tend to have been most surprised and excited by a lot of the student-led ventures that have emerged. These students are still in college and they have already commercialized a product and it's in market. I think of NARA out of Southern USC, my alma mater, by the way, fight on. Which is automating, all kind of workflows for home health agencies. And there's a lot of these examples. Another student-led venture, Thomas Biddings Jr. with Goldilocks Smart Solutions, who has created the first voice-activated shower controls. To really think about how profound that is. Imagine a caregiver, right? An RA in assisted living, hands-on, helping with a shower, no longer has to take hands off to control the shower. Right. So, and this is a guy who a year and a half ago had a concept and won a pitch competition. And today he's deploying in care homes. So I'm passionate about it. I find that these young entrepreneurs are very good at listening, right? And I think a lot of the older, and I think it is stage of life related, maybe not age related, but you show me somebody who's in their mid 40s and 50s who lost mom or dad to Alzheimer's and thinks that they know what to build for the industry and races out there. They're going to hit a lot more speed bumps than those entrepreneurs that are younger, that are listening and don't know as much. And
no, I agree. I think it
really helps them.
Well, they ask different questions, to your point. When you've sort of experienced life and experienced more patterns around that, I know I certainly do. You tend to fall into a pattern around how you react to things, how you see things. I've worked with some students from Stanford, has a wonderful program around AgeTech. There are a number of universities that are doing some amazing work, and more all the time, which is great because we need more geriatricians, and we also need more people building in this area. And it's exciting to see some of these people with completely different ideas. I will say I do believe in the older entrepreneur as well. They say that the most successful entrepreneurs tend to be somewhere between 45 and 65. And I've seen amazing entrepreneurs in their 80s. But they bring different strengths to the table, and it's interesting to see how that shows up in the solutions they offer, how that shows up in how they work with people. I think we need all of them, but it's interesting to see the different strengths and weaknesses there.
Yeah, I just saw David Brooks released a book called "You May Be a Late Bloomer." I don't know if you saw that.
Yeah.
On the topic, I agree. Listen, I'm 63, about to be 64, and I've had many people ask me, what the heck I'm doing starting this thing, at this advanced age. So I totally agree. I think everybody brings different things to the party at different stages.
So I have a question for you.
Yeah.
With all of these great ideas, a lot of them unfortunately hit the wall hard around who's going to pay for them. And that's, you and I were chatting the other day about this. I'm excited to see some of it, but let's talk about that for a second. There's some new ways that these could be paid for. There are a whole lot of new acronyms, everything from team to access to guide to a bunch of other acronyms, but these are interesting programs that are starting to potentially pay for some of these solutions and move them into meaningful use within the existing sort of limitations and guardrails of healthcare and senior living. So yeah.
Go ahead and flesh out the question a little more. I think I know where you're going.
Where are you most excited? I mean, these some of them are very specific, some of them are a little more broad. We have guide focused on dementia. It's interesting to see sort of where the priorities show up. But talk to me about if there's one that you're particularly excited about, you think has real potential, and I'd love to know why.
Yeah. So first of all, I think, one of the things I learned as a preface to the answer. So I've been through 3 adventures as a buyer of senior living for family members. And with my mom was the first one. That was the first thing I learned, much to my surprise. I didn't know anything about senior living. I hadn't founded AgeTech Connect. Is that probably as a part of mom was at a Sunrise in Beverly Hills. I realized my mother was not in a healthcare environment, like a senior living operator this was not a healthcare provider, right?
Yeah.
It was a provider of services, but it wasn't healthcare. We weren't in a hospital called Sunrise, right?
Yeah.
I think what we're seeing is a convergence of senior living and healthcare taking place before our very eyes. I think if you look at if you look at what senior living operators do best and what their capacity to do different things. If you look at the CMS team program, this is maybe where I'm most excited for entrepreneurs. You would think it's Access, but I think Access is a more challenging program. Well, I don't want to get into that. But team is basically said for 5 different fairly common and expensive procedures, hospitals care providers are going to receive 1 capitated rate. Right. So mom falls and has a femoral neck fracture, hits the ER door, right? And then moves through the ER, through triage, gets admitted, has surgery, stays, gets discharged. And then 30 days past discharge is when what that capitated rate covers. And anything that goes wrong falls to the care provider. This is similar to, I don't want to get into weeds, but this is a new evolution of value-based care, but it's hospital facing. So this creates tremendous incentives for that care provider to ensure that the care transitions are right? That wound care and home exercise programs, environmental modifications if they're needed, all variety of potentially automated or tech-enabled check-ins and remote visits and all these things to ensure that is a successful journey, not just for the patient to have a great outcome, but also not to have a readmission, sometimes with catastrophic complications that would send those cost overages through the roof and be paid for the provider. So that's a long-winded way of saying who's better positioned to partner with hospitals than senior living operators. And I really think there's no better partners. And That doesn't mean that the sniff is not still critical, that rehab. It is, but it's a part of the journey, right?
Yes.
And so like my dad's journey, he was living independently, had a catastrophic accident, moved through the hospital to acute rehab, to subacute rehab, to assisted, never went home, right? That was his journey. All these journeys are different. There's not like one journey. So I think CMS team, as it relates to musculoskeletal, lower extremity, right? So hip and knee replacement and hip fractures. This programming creates tremendous opportunities for technology providers and care transition providers and senior living operators to work together. And anecdotally, I hear about it all the time. I would be curious to know if you guys are looking at that at Sequoia, or maybe already doing it, or if you're hearing about it as well. But this is an area that I'm really enthusiastic about.
No, and I agree. Having run a large post-acute center in my previous role, I've seen this firsthand and seen the challenges and the opportunities around it. And transitions of care are both very important from a care delivery and sort of care efficacy standpoint, but also from a reimbursement standpoint. And I'm very optimistic about how we're looking at those transitions and where people end up and how we're supporting them through those transitions more effectively than ever before. The one challenge with that is by requirement, you have to understand more about the patient and then maybe eventually resident than we have historically in the past. The hospitals have been good about tracking this information. I will say senior living operators have been less prepared to do some of that data work that's necessary and the follow on, and especially the transitions out of the formal environment back to the home. So there are opportunities, and I've seen a number of startups look at these areas, but the challenge is trying to solve that in isolation. And this is, again, where bringing the different pieces together is critically important. And programs like Team does exactly that. It forces the confluence of all these factors together into the same room. They say you have to work it out because otherwise everybody loses. So I am also optimistic that this will help push things forward, bring the right solutions, the right people, the right teams into the same room, and force evolution in that area too.
I think it creates a new buyer also, right? Because really a health plan, Medicare Advantage plan, is really not a buyer, you know? And so, but you're just thinking, extemporaneously here off the cuff, does the hospital become a buyer of grab bars for medically fragile patients going back home? Yeah. Maybe is the answer. We'll know in about a year, right? To see how it all plays out. But that's very logical. If that can mitigate, if an $80 grab bar installation can mitigate a much bigger problem, suddenly that becomes a prescribed part of care.
Well, and you've seen that shown up previously. I hear you, but it's been in Medicaid waivers in certain states before. But I think this is different because it forces the collaboration and coordination of those solutions, and hopefully tracking the outcomes a little better than the episodic or fragmented approach that's been the case in the past. It's interesting to see. Yeah, go ahead.
I also I don't know if you agree with this, but I think that the entrepreneurs that have created some, and I'm not going to, this is kind of like where we've seen some lack of success, so not naming any companies, but there's been some really thoughtful and interesting startups that really are trying to re-engineer care transitions.
Yes.
And they haven't succeeded because there really wasn't a buyer. There wasn't a payer for that product, right? So it's kind of like everybody kind of knows it's a problem, but there's nobody around to pay for it. So it doesn't get addressed because it can't find its place in the revenue chain.
Well, this is where I'm excited. It's a tiny part of the market still, but it's finally starting to grow and accelerate. Pace, of all things, that's another area where you have a capitated model where you have the payment following the outcomes. And I'm starting to see some really exciting things happen in PACE and also in sort of other community-based programs where there's an understanding that you have to bring together all of these both clinical and non-clinical elements to make for success in the long term. So I am very optimistic about both programs like Team, but also some of the other growth and evolution in programs like PACE that have been around for 50 plus years, but are finally starting to look at the data, look at providing feedback so the payers go, hey, maybe we should pay attention to this. This actually does make sense, and it actually saves us money. So I think that'll help move the ball forward too.
I agree. PACE programs now are kind of like, imagine there was somebody who, was showing up at clubs playing guitar for 30 years, and suddenly overnight, everybody wants to hear him play.
Yeah.
That's PACE, right? Everybody wants to talk to PACE programs today.
Right. So we've talked a little bit about what we're excited about. There's also, you and I hear a lot of the same things and meet a lot of the same companies, but I'm interested in if there's something that you get tired of hearing about at this point too. There's some pros, there's some really exciting, interesting and different thoughts around how we can do things differently, better. What are you hearing that you wish you'd hear less of?
So paradoxically, first of all, I'm tired. Look, it's tired is it's the right word. I think I think if anything has proven itself out in the AgeTech space at large, and whether these are products and tech-enabled services that situate themselves in senior living, or in the care continuum or elsewhere, I think we can maybe put to rest the idea that adult children are going to be buyers of products that'll be adopted by seniors, and that's a way to find product market fit for an innovation. I think this is, this is like the pathway on the little road with the skull and crossbones. That is just not working, right? For many, many, many reasons. The other thing too is interesting to me, and this is paradoxical. Last year, I think we saw a phenomenal amount of success in terms of companies finding venture funding and large amounts of it.
Yes.
In the singular area of monitoring, right? Ambient monitoring, fall detection, and some of those were modifications on legacy nurse call systems. But the companies like Inspiron, Sage, Safely You, that all and others, Nobi, that all closed very significant rounds. Big vote of confidence. If you look at the venture world, that's saying,
yes.
That said, those exact kind of companies are the ones you really, there's just so many of them. So it's almost like there was a success, but every day I talk to another entrepreneur who has this multimodal, we've got sensors, we got a watch, we got a companion, we're going to put it in rooms, and it's going to do this, that, and the other. So it's kind of like a red ocean. Like, it's fatiguing to see so much new innovation that looks like, it seemed to be like a bit, copycats of things that are working, already. And I think some element of being novel is a part of being a successful entrepreneur, right? Non-novel products and services don't tend to catch fire.
I agree in part, but I will disagree with you in one area, which is I am actually excited by using an older pathway, if you will, or older mechanism, specifically nurse call, as an underlying foundation for a lot of other things. Yes, we have too much in the way. Too many companies are saying, we're going to be the platform for everything. We will have all your data and we will know everything. And I frankly don't believe it in most cases. However, we know that within senior living and healthcare writ large, it's better generally, at least to start within pre-existing workflows and process so that it's familiar to the people you're trying to work with. And it works.
I could not agree with that more. Like that, that's an entrepreneur textbook paragraph right there. Could not agree more.
So I'm excited to see where some of these are combining. So, and it's more a matter of the right ingredients. If we're building a recipe here, if you will, I think we're finally getting down to what are the right recipe elements, what are the right ingredients to make for something that is actually compelling without just throwing everything you have in the cupboard into it and expecting something to taste good.
I agree.
Yeah, go ahead.
I think also just working with entrepreneurs, I get asked for introductions, and to the extent that I'm able to make them, two things. One is I always encourage the entrepreneurs that if you get a CEO or CIO on the phone or on a Zoom call, don't pitch them what you're doing. Ask them what their biggest problems are and try to learn those, because what you're pitching them is really not relevant to them. I also believe that more innovation could come from entrepreneurs that were willing to dig deeper and harder to work with the clinical teams and
Yes.
learn from the clinical teams what their biggest problems are. I think that's a really untapped opportunity. It's rare that I see an entrepreneur that says, I want to meet with clinical teams and learn what their problems are as a part of raw discovery without an agenda attached to it. Not enough of that.
No, I agree. And I think that is a major failure point too, because then all of a sudden the clinical teams who have enough on their plate or too much on their plate already, potentially trying to ingest this new solution that somebody else thinks is a great idea. And they're like, really? Tell me why. And again, that's true throughout. I mean, even something as simple as rolling out a new electronic health record, you bring the clinical teams, that's where you start. You always have to start with the people who are going to be using this. So understanding your customer, to your point, and also that the clinical elements are critically important, because you can't get past those in most cases, depending on the solution, of course. There are other hospitality solutions and some other really exciting things, but for a lot of these solutions, there is going to be a clinical element, and it's critically important to have their buy-in. I'm interested in one more. Yeah.
By the way, sympathy to the entrepreneur that's trying to get that information. If you think it's hard to get a CEO on the phone, you should try getting a,
director of nursing,
DON or head of clinical. It's 100 times harder because they're on the floor, or right, but it's worth the effort. It's worth the effort. Yeah.
Well, and I've seen some entrepreneurs actually live at senior living communities for a while. Some great programs of entrepreneur in residence have actually put people in communities so they actually live the life for a few days or a few weeks. And it's exciting to see that more of those are showing up. The one last thing, and it ties into some of the clinical aspects and sort of brings some of these elements together that I'm really excited about, and I'm interested to see or hear what you've seen around this, is a growing focus on health span and longevity in senior living. And some of the newer solutions, you and I both go to a lot of industry events. I'm seeing an interesting pattern emerge with a growing focus on health span and what that means for the future of senior living. What are you seeing around that? What are you excited about? What do you think is hype at this point?
I mean, I think it's the thing I'm most interested in. On another call, because it's a long topic. But we're also lucky to be alive, and the potential of the human being to improve, get stronger, get wiser, get better, have more purpose, do more things is almost limitless. I think this is the greatest potential for senior living as an industry, and they're ideally positioned to be the leading innovators in the space. Some of the solutions that are doing things can be very, very kind of niche, but I mean, I am in love with what One Step is pioneered, as they have completely gone beyond the idea of gait analysis into mobility intelligence, and are just unlocking so much potential. And the potential isn't just to decide if someone should get 2 weeks more of physical therapy, right? We're unlocking, I think strength and mobility and social connections are the two things that anybody can work on at any time that will yield some of the greatest results in your life to get stronger, better, healthier from any starting point. So like One Step is an example of a company that is just breaking new ground to doing tremendous things. There are others, but that is an example. And I think the things that reach inside the walls help clinical teams and resident engagement teams help those residents to live healthier, stronger lives. It's a win for everybody. It really is. And I think I've told you, we have a personal story. When you see somebody who should, by all kind of stereotypically, you think would have a downward trajectory, get stronger, healthier, and more active. It costs the healthcare system less money. The family costs the family less money. Everybody's happier. The operator is happy. It's just a win all the way around. And I'm just tremendously excited about those things. And senior living as an industry's ability to be at the very, very, very front line of innovation for those technologies and tech-enabled services.
We have the opportunity because we understand more about these residents and the people where the science can advance more than any other part of the world, where we understand nutrition, we understand their healthcare, we're tracking all of these data. And we've seen science show up sort of episodically outside of senior living in the broader community, and some interesting, the science is advancing rapidly, but I'm much more excited, as I think you are as well, because senior living has this opportunity to bring all of these elements together in a way no one else can right now, and really see the efficacy early. So I'm excited to see, hopefully that topic show up in many of your AgeTech communities around the US, and really see this prosper. And hopefully we'll see more entrepreneurs focusing on this area as well.
Well, it will be, as you know, we have a small plug here. So our summit this year will be September 18th at the Buck Institute for Research on Aging. I know that Sequoia has a leading role in their LIVE programming, and is a pioneer there. And these topics, especially health span, will be foundational to the narrative we're going to be creating for that day. So you'll see it prominently featured in our biggest event of the whole year. So I look forward to that. And I look forward to having you involved in it. So we were talking about that yesterday as well.
Look forward to it, Jeff. Well, thank you so much for joining us today. You can find Jeff and these communities and cities around the nation on LinkedIn. You can find Sequoia Living around California. And we look forward to meeting you at some of these events and continuing these conversations so we can push the industry forward. So thank you for joining us, Jeff, and excited to hopefully see you soon.
Thank you. Good to see you soon. And thanks for inviting me.
And thanks to Steve Moran for having us on here today as well.